At nagbabalik muli ang Doctors on TV. Kasambahay, we're still talking about osteoporosis. Kasama pa rin natin ang napakahusay at napakagandang doktora na si Doktora Pebbles.
Na-conscious ako.
So, Doktora, we're talking about osteoporosis. Naging marupok ang buto. Patients are more prone to fractures.
And falls.
And falls. No? So, we talked about how to at least delay osteoporosis by proper diet, nutrition, avoiding too much coffee and smoking, and diagnosing early kung may hyperthyroidism ka, for example. How do we prevent falls naman?
O, kasi pagka... So, sa bahay, simple lang. Kung meron kayong rug or carpet, make sure na it is stable, secure. Secure on the floor.
Kasi doon napapatid si Lola.
Kasi doon napapatid. Mag-iwas tayo ng mga kable na mahaba. Halimbawa, yung plug sa kuryente.
Okay.
Make sure nakadikit sa dingding o kaya talian ng cable tie para hindi nasasabit si Lola or si Mommy for that matter. Sa gabi naman, kasi di ba minsan hindi na ihi na ng ihi eh.
Alright.
So you make sure na may night light para nakikita yung dinadaanan. Kasi mamaya matisod nga sa let's say yung upuan, no? Mababalian. Make sure sa banyo din meron silang mga handrails.
Okay.
Sa palikura, doon sa paliguan mismo, merong mga bath mat or kaya yung anti-skid strips.
Anti-slip.
So, para hindi sila nadudulas.
Okay.
So, preventing a fall is also very important. Kaakibat talaga niya ng osteoporosis.
So, minsan may mga laruan sa sahig, no? Doon hindi nakikita ni Lola na
Kasi mahina na rin ang mata.
O kaya may spill, may natapon na tubig, dapat i-map agad
So,
siguro.
yung sapatos din na pag-usapan natin, medyo hindi na pwede mag-IL si Lola. Kailangan, na sila, very sturdy ang sapatos nila. Huwag madulas ang ilalim. So,
dapat
rubber
siguro
sole.
rubber sole.
talaga.
Tsaka meron ba tayong, dapat ito lang yung ating allowed na konting elevation.
Hindi na pwedeng mga 3-4 inches.
Hindi pwede yung ganito sa atin, ano?
Hindi pa pwede siguro sa second floor ang bedroom ni Lola.
Dapat,
Baka
true.
ilipat na sa first floor.
Very
Kasi
true,
may mga
yes.
patients na nahulog sa stairs,
Yes.
no?
So, nangyari yan sa lola ko.
Oo.
Important for me. I stress that to my patients, lalo na pag na-diagnose mo na may osteoporosis, kasama na nun yung fall prevention.
May mga nagrereklamo, especially yung may mga cancer, no? Like mga breast cancer. Doktora, ano naman ang risk sa mga may breast cancer na sa osteoporosis?
I think it has something to do with the treatment that they had also, no? So, pag nagkaroon na sila ng, let's say, chemotherapy and radiation, it really increases the risk for osteoporosis kasi talaga the medication itself has affected the bone metabolism. Radiation affects bone metabolism.
Ano namang ginagawa natin dun sa mga na-diagnose na may osteoporosis pero hindi pa nagkaka-fracture?
Okay, so treatment, no? Of course, yung pareho pa rin as your prevention, calcium, vitamin D, exercise. Mainstay na yan. And then you talk to them about yung mismong gamot na para sa osteoporosis. Dahil nga sabi natin, prevention siya, minsan kahit osteopenic pa lang or low bone density pa, pag-isipan mo nang i-treat ang pasyente with medication. So marami na tayong gamot sa market, no? Ang gold standard yung tinatawag nating bisphosphonates.
Okay.
Bisphosphonates are anti-bone resorption. So basically, piniprevent niya na yung calcium sa buto mo ay kukunin pa rin.
Alright.
So, yun yung gold standard natin. But the others that are available, there's yung bago ngayon, yung rank ligand, anti-rank ligand. Meron din tayo yung strontium ranelate. Ito naman, nagde-deposit ng mineral sa buto.
Okay.
Meron din tayo ng teriparatide. Ito naman, yung bone former. Among all the medications, ito lang ang bone former, no? Yung teriparatide. So, it depends, no? Kung anong hiyang ang pasyente. Kasi minsan, mas hiyang sila sa oral. Minsan, mas gusto nila injection. So, tsaka kung gaano yung compliance ng pasyente. Ako mas tinitingnan ko yung compliance eh. Kung magko-comply sila sa pag-inom ng gamot daily, then you give them the daily medication. Kung mas magko-comply sila sa once a year or every 6 months, then you look at that. So, yun yung ating mga
So, ayun,
treatment.
maganda ngayon, no? Kasi mga 15 years ago, we didn't have the medications for osteoporosis.
Yes.
Puro calcium, vitamin D, and exercise lang.
Calcitonin was also one of the first
Correct.
medications that
But
we used to
nowadays,
give.
marami na tayong gamot. So, mga kasambahay, if you have osteoporosis, you should see your doctor para you can be given the appropriate medication.
At kaya naman pala, no, Dr. M?
Oo.
Kaya naman palang ma-regenerate o mag-grow back.
So, Doctor, what doctor should a patient go to? Kasi ang dami nagtitreat yata ng
Yes,
osteoporosis,
kasi
no?
it's it encompasses all ages and all sexes, both sexes. So, sa akin, you can go to of course, your orthopedic surgeons because we're bone doctors, no? But the obstetricians, the endocrinologists, also the rheumatologists, no? They're very familiar with osteoporosis. And so, I would suggest, ito yung mga top doctors natin, but I think all the doctors are very familiar with osteoporosis. I suppose it depends on their comfort level with the disease, no? But I would say ito po yung top 4 natin. Rehab doctors also.
Yes.
They're also very active in treating osteoporosis. Sila ito yung, I would say, the specialties that are very active with the advocacy of osteoporosis.
So, even the orthopedic surgeon helps prevent,
Yes.
no? Hindi lang pag na-fracture, tsaka lang pupunta sa orthopedic surgeon.
Kasi pag nag-fracture ang pasyente, hindi lang yung fracture ang iti-treat namin eh.
Okay.
Kailangan pati yung osteoporosis iti-treat mo.
True.
In your, naman sa endo, pagka na-detect mo na osteoporosis, kailangan yung metabolic cause also is something
Yes.
that you treat. Kundi hindi matitreat yung osteoporosis, di ba?
You have to treat the cause,
Yes.
not just the present problem.
Yes.
Okay. So, maraming salamat,
Thank
Dr.
you very
Pebbles.
much,
We learned
no?
a lot this Sunday morning.
Ako din, it was nice to be able to explain disease entity without rushing.
Any
Longer
final
period
words?
of time din.
Oh, yun, tama. Any final words po sa audience natin? Dr.
So for our patients or for our viewers, importante ho, calcium, vitamin D at exercise. Pangalawa po, yung ating maagang pag-screen, no? So kung meron kayong mga risk factors that we have mentioned earlier, please do not hesitate to go see your doctor, whether it's your internist, your family doctor, and ask them about osteoporosis. And if you have been diagnosed with osteoporosis, wag po kayo mawalan ng lakas ng loob. Kasi po, ito ay natutulungan natin ang mga pasyente tungkol sa osteoporosis. We can treat them. There's even a lot of groups, no, that are advocating osteoporosis. So, let us, work together so that we can prevent fractures and we can prevent osteoporosis.
Ayun.
And just in case our audience wants to find you, where can they find you, Dr.?
Dito sa GMK.
Every Wednesday sa Good Morning, Kuya. Ito si Dr. Pebbles. Anyone you want to greet po, Dr.?
Hello to my GMK family. I'll see you on Wednesday.
Alright.
Also to my
GMK is from
family.
5 a.m. to 8
5:30 to
a.m.
7.
5:30 to
7:30 in the morning. Also to my family, my
Okay.
parents, they're watching, and my sister, and my husband.
Nandito sa studio.
Oo
Yeah.
nga, so susunod siya naman.
Next time, we'll get him to guest naman for us. So maraming salamat ulit, Dr. Pebbles, Kathleen Antonio. Huwag muna kayong alis, mga kasambahay, magbabalik pa po ang
Doctors on TV.